CTV News. Now, for our health section of the night, we have found an interesting piece of news: stethoscope hygiene, or rather, the lack of it, and what consequences that brings. In a study of over 1,300 pediatric healthcare workers, 76% believe that transmission of disease could occur via stethoscopes, but only 24% disinfected their stethoscope after each use. But that doesn't seem too bad compared to a study of medical students, which found that 90% of them did not clean their stethoscope at least once daily. Now, why is this an issue? Well, stethoscopes come in contact with many patients in the course of a day, and may even be used by different healthcare workers if they don't have their own stethoscope. One study found that stethoscopes transferred two common healthcare-acquired infections, MRSA and C. diff, during simulated patient examinations nearly as often as gloved hands did. MRSA can live on surfaces for 7 months, and C. diff can live on surfaces for 5 months. A Mexican study actually found that 62% of stethoscopes on an adult unit were found to have colonies of MRSA on them. Now, I did something completely ethical and placed a secret camera at MSB General Hospital with the agreement of a patient currently admitted there who was complaining of a lack of stethoscope hygiene among the nurses and doctors. Let's take a look.
Good afternoon, Mrs. Smith. How was your nap? Good. I'm just going to take a look into your lungs for a second, okay? Okay, I'm going to get you to take a couple deep breaths for me. Okay, and in. And out. Good. Okay, and in. And out. And last time. In. And out. Okay, good. Are you feeling okay, Mrs. Embry?
I'm sick.
Okay, well, you're in the hospital.
I'm finding it hard to breathe.
Okay, well, let me just take a listen to your breath sounds there. Okay. I'm gonna.
Whoa! When was the last time you cleaned that stethoscope?
Well, this morning.
Well, I don't want to get any of that MRSA.
Well, Miss Embry, you need to realize that the physicians here and the nurses are all very, very busy. And we don't have the time or the money to be cleaning in between every patient.
Well, I want to get better. I don't want to be in here any longer.
I don't even know if I have an alcohol swab on me. You're lucky this time, and this is just going to be for you.
Well, that was shocking, wasn't it? According to the Public Health Agency of Canada, rates of MRSA have risen from 1 per 1,000 patients in 1995 to 6 in 1,000 in 2009. And 3 times the amount of people are dying from C. diff now compared to 1997, 17 years ago. 200,000 people get a healthcare-acquired infection each year, and 80% of them are spread by healthcare workers, visitors, and patients. 8,000 people die from a healthcare-acquired infection each year, and combined, they result in an estimated $1 billion in direct costs annually. Now, there are obviously many factors besides stethoscopes contributing to these numbers, but regardless, stethoscopes need to be cleaned. With the increase of superbugs, which are resistant mutated bacteria and viruses, it is even more important to clean your hands and your equipment. A review of the literature pertaining to best practice on stethoscope hygiene found that cleaning the diaphragm, tubing, and earpieces with ethanol-based cleaners resulted in a 94% reduction in bacterial growth. As a patient, don't be afraid to advocate for your health. And hospitals, maybe you should consider implementing this evidence-based practice change of regular stethoscope hygiene. Now, over to you, Cindy Day, with the weather.
The coolest part about my job is helping thousands of people plan their day.